Good morning, students. Today we will continue with the chapter 4, that is disaster management. In the previous video, we have learned about some remedial and preventive measures of natural and man-made disaster and first aid for external bleeding, burns and scars. Today, children, further we are going to learn about first aid for sunstroke, snake bite, dog bite and their remedial measures. Let's start. Now, the third one is sunstroke. If a person works continuously for a long time in the sun, then the body loses water and minerals. This dehydration results in sunstroke. Dehydration means children removal of water or excess amount of water is removed from our body in the form of sweat. That is called as a dehydration. And due to this dehydration, there is a formation of sunstroke. Now, some remedial measures for sunstroke. The first one, the patient should be immediately taken to a cool place or in the shade. So, we have to take the patient in case of any cold place or in the shade. The next one, the body should give a cold sponge bath. So, we have to give that full body of the patient sponge bath or wipe full body with the help of cold sponge bath. The next one is the neck of a patient should be covered with a wet cloth and we have to cover the neck of that patient with a wet cloth. Next one, patient should be given water or sherbet to drink in order to stop the dehydration. If possible, we can provide water or sherbet to that patient for removal of dehydration. The next one, children, patient should be made to lie in prone position, that is on his or her abdomen with the head turned to one side, so that patient should be lie in case of abdomen with the head turned on one side. It means children, head should be looked one side. Like that we can make patient. Next one, in case of seriousness of sunstroke, shift the patient to the hospital or get medical help, and if that patient is serious, then we have to shift that patient in the hospital or we can take any medical help. Now, the fourth one is snake bite. All snakes are not poisonous. Only few such as cobras, kraits, vipers and sea snakes are poisonous. Bite poisonous snake is fatal. It means it causes even death also. But bite by non-poisonous snakes can also cause psychological shock resulting in the death. Sometimes if any snake is biting, that snake is not poisonous. But due to psychological shock, it means children, some are thinking that I got bite from snake, and due to that also it causes even death also. Instead of killing, one should try to save the snake with the help of volunteers who rescue the snake and release it into its natural habitat. It means instead of killing that snake, we can call Sarpamitra. Then the Sarpamitra is catching the snake and they are sending it into the natural habitat. Now, remedial measures for snake bite. The first one, giving emotional support to the victim means children, if any person is there, you can give emotional support. Next one is washing the wound with water. So, whenever that snake has bite that part, we have to wash with water. Next one, tying a tie cloth above the wound so that the poison does not reach the vital organs. So, if snake bite to leg, then above that part you have to tie the cloth so that if poison is there due to snake bite children, then poison will not spread other parts of the body. And last one, seeking medical help immediately and giving any anti venom to the victim. So you can take medical help or you can give anti venom to the victim. It means anti poison to the victim. Now, the next fifth one is dog bite. The dog bite can be dangerous if the dog is not vaccinated by anti-rabies vaccine. As you know, dog has disease rabies, and for prevention of that disease, we are vaccinating to the dog with the help of anti-rabies vaccine. Hence, immediate care and medical help should be given to the victim as rabies is 100% fatal. It means due to rabies disease, it is causing death also. Now, some remedial measures for dog bite. The first one should be first cleaned and then washed with potassium permanganate solution. One should be covered with clean and dry cloth. So, potassium permanganate is what children? Yeah, it is one of the solution, and with the help of that solution, we can wash the wound. Next one, taking help from a doctor. Victim should be given any anti-rabies vaccine and care for his or her wound should be taken. So, in case of dog bite, we can give anti-rabies vaccine to the patient also, and we can care of that patient's wound also. Now, children, it's time for recap. What we have learned in this lesson so far, children? We have learned the first one is a sudden calamity is known as disaster. The next one is disaster can be man-made or natural. Next one, alertness and immediate action are necessary on such occasions. Now the next, effective disaster management and use of remedial measures can help reduce the losses. And the last one, every person should know about safety, precautions and first aid. Now student, I hope you enjoyed the lesson. Thank you. Stay safe.